Welcome to Ask Dr. Clark's Sex Offender Education Series. Dr. Clark, can you tell us a little bit about child molesters?
Child molesters are people who molest children, sexually molest children. They may or may not be pedophiles. So if you remember from our other video, a pedophile is someone whose primary sexual arousal object is a child. And that person may or may not molest children. So a child molester may or may not be a pedophile, but it is someone who has molested a child. Now, if they're not doing it because they're a pedophile, then they're doing it for several other possible. If they're not molesting children because of pedophilia, then they may be molesting children because they see a daughter, for instance, as a substitute wife. Maybe they lost their wife. Maybe they don't feel comfortable with their wife. They're going to use the excuse that, oh, my wife is demanding, controlling, overbearing, I can't handle it. And they turn to a younger person, a daughter who's available, who they feel they have power over, as indeed they do. And they will use that child as the substitute wife. So there's that power over a child which compensates for their own inadequacies, their perceived inadequacies, or their social inadequacies. They have a fantasy, feelings of being loved and revered. So who loves daddy more than a daughter? And so you may have a father who is using a daughter not only as a substitute wife, but someone who is going to adore him. And you'll notice these are people who are not using threats and violence towards the child. Child molesters are usually going to be very nice. They're going to groom the child. They're going to give the child a lot of perks. The child is going to get a lot of benefits from allowing themselves to be molested. And I say allowing themselves only in the sense that they're going to not be actively fighting back. But since they are children, they certainly are not able to give consent. So don't mistake me there. Okay. But they're going to go along with it because of the perks, because they want the parents' love. It's not always fathers and daughters. It could be fathers and sons. It could be mothers and daughters. It could be mothers and sons. So women also molest children. And then there's the group of people who compensate for being abused themselves. And that's an interesting dynamic because it used to be that research told us that about half of sex offenders had been abused themselves. The reality is more recently, because the sex offenders being interviewed and claiming that they were sexually abused as children were already incarcerated. They've been convicted and incarcerated. And so they are a specific population that in general loves to get over on authority figures. And so some recent research has shown that they actually lie. Surprise, criminals lie. So they lie about having been abused as children. It's just their way of having fun while they're in prison. And so the actual numbers of how many kids who were offended against grow up and become sex offenders, we don't know. We just don't know. There's no way of knowing. It's very difficult to research. However many there are, it's certainly not an excuse. It's never an excuse for becoming a sex offender. So a child molester who's choosing to molest a child, again, how much are they choosing when their prefrontal cortex is offline and they can't really think because these drives and compulsions and obsessions are really going on back in the limbic system? And yet we still have to hold people accountable for their behavior no matter what, and we will do so. So there you go. Child molesters molest children. The victim is the child, who is a distorted figure that satisfies the need of the child molester. And so our treatment goals, if the child molester is not a pedophile, where we need to kill their sex drive, we may be able to help that sex offender engage in age-appropriate sexual relationships. We can help heal past trauma, if that is really a driver for them. We can help them increase feelings of self-worth and feel more adequate. So they're treatable with psychotherapy in a different way than our pedophiles who molest children. So that's our story on child molesters.